Now let us talk about diabetes. We have diabetes mellitus and we have diabetes insipidus. In diabetes mellitus, let me first differentiate between diabetes mellitus and diabetes insipidus. Diabetes mellitus has to do with a metabolic disorder characterized by high blood sugar, while diabetes insipidus is an endocrine disorder characterized by excessive urination, which is called polyuria. Now I'm going over to the diabetes mellitus. Diabetes mellitus is of two types, which is type 1 diabetes mellitus and type 2 diabetes mellitus. The type 1 diabetes mellitus is called insulin dependent diabetes, while type 2 diabetes is called non-insulin dependent diabetes. For the type 1 diabetes, of course, in the pancreas is an endocrine organ that produces two major hormones, which are insulin and glucagon. There are other hormones like somatostatins, but I'm going to be in particular with insulin. There are cells in the pancreas called beta cells that actually produce this insulin. Remember, I'm talking about the type 1 diabetes, which is an insulin dependent diabetes. So, when there is an autoimmune destruction, when someone has an autoimmune destruction is a condition where the immune system begins to destroy healthy cells. Maybe the immune system mistake it as being harmful to the body, so they begin to destroy them. So a situation where the immune system begin to destroy the beta cells of the pancreas, it means that insulin will not be produced because it's these beta cells that actually produce the insulin. So when the beta cells are being destroyed by the immune system due to autoimmune condition, the beta cells will not be able to produce insulin. And what is the function of this insulin? This insulin is a hormone that helps to regulate the blood glucose level. If you take any carbohydrate, if your blood glucose level has been spiked, maybe by carbohydrate, the insulin will be released by these beta cells into the bloodstream to cause the uptake of this glucose into the cells of the body. So when this insulin is not there in the bloodstream, when you take a carbohydrate, it means that the blood glucose level will be high, and this is bad. So when this insulin is not produced effectively by the beta cells of the pancreas due to destruction, now diabetes can occur. There will be a high blood sugar because the insulin produced by the beta cells will not be there. So that is a type of diabetes that is very rare. We have about 20% of cases of diabetes mellitus, particularly type 1 diabetes mellitus. But the type 2 diabetes mellitus, which is insulin dependent, is the most rampant type of diabetes or cause of diabetes. This has to do with lifestyle factors, diet, the kind of diet you take, maybe people that take too much sugar. This is where you can have type 2 diabetes. So this is the one we have like 80% of cases of type 2 diabetes. Now I'm going over to the diabetes insipidus, which I said is an endocrine disorder. There is a part of the brain called the posterior pituitary gland. In the in the pituitary gland, we have the anterior pituitary gland. The pituitary gland is actually located in the brain, and it's called the master gland. That is, it controls all the endocrine glands. So we have the anterior pituitary gland and we have the posterior pituitary gland. I'm going to be in particular with the posterior pituitary gland. The posterior pituitary gland stores two major hormones, which are called the antidiuretic hormone or ADH or vasopressin and oxytocin. These two hormones are being produced by the hypothalamus, and it stores it in the posterior pituitary gland, and it will be released when the body needs it. So when someone has diabetes insipidus, in diabetes insipidus, you have two major types. You have central or neurogenic diabetes insipidus and nephrogenic diabetes insipidus. So when someone has a central or neurogenic diabetes insipidus, it has to do with a problem with the nerves or the brain. So when someone has this neurogenic diabetes insipidus, it means that there will be an insufficient production of the antidiuretic hormone, which is being produced by the hypothalamus. Now, what is the function of this antidiuretic hormone? This antidiuretic hormone helps to retain enough fluid inside of the bloodstream to conserve water. When someone is dehydrated, of course, when you're dehydrated, you don't urinate often. This is the ADH working. The ADH is now signaling the kidney to stop the release of water out of the body. So the ADH helps to conserve water inside of the bloodstream to keep the volume at the normal range. So when someone has this a problem with the production of the ADH, the person will be urinating excessively. That is polyuria. When there is an excessive urination due to the inability of the hypothalamus to produce the ADH. So that is the type of diabetes mellitus. The cardinal sign is excessive urination because the ADH is being altered. Now, going over to the second type or cause of this diabetes insipidus, which is the nephrogenic. This has to do with the kidney. Now, in nephrogenic diabetes insipidus, the ADH is being produced, but the kidney that actually get the signaling is being altered. The kidney is not being sensitized when ADH comes in, because the ADH is what signals the kidney to tell the kidney to release water when there is excess water, or to conserve water when there is low, or when the person is dehydrated. So the kidney in nephrogenic diabetes insipidus is not responding to ADH signaling. So this can cause excessive urination. When the kidney is not responding to ADH signaling, it means that there will be urination, there will be excessive urination, because there is no particular hormone, which is the ADH, to control the kidney, to tell the kidney when to release urine or when not to release urine. Now, we have a question about the diabetes insipidus and the diabetes mellitus. You can drop it in the comment section. And remember, the diabetes mellitus is a metabolic disorder caused by high blood sugar, while the diabetes insipidus is endocrine disorder caused by reduced production of ADH, or inability of the kidney to respond to ADH signaling. If you have a question, you can drop it in the comment section. I promise to reply to them. Thank you.